with seasonal influenza, the mortality rate is about 0.1%. With COVID-19, it's about 1 to 2%, depending on the jurisdiction that you look at. So we're looking at a mortality rate of about 10 to 20 times greater than seasonal influenza. It's typically people that are older, and it's people that have comorbid medical conditions. And what I mean by that is they have other issues with their health, like diabetes, hypertension, cancer. So COVID-19 is not an airborne virus. So when we talk about airborne viruses, we're talking about things like measles. Measles is incredibly contagious. If you haven't been immunized against measles and you haven't had it before, if you're in the same room as someone that has measles, you are at risk of contracting it from that person. That is not the case with COVID-19. COVID-19 is transmitted by droplets. And so what that means is it's particles, liquid particles that someone will potentially emit if they're coughing or sneezing. And it's really in the meter or two immediately around that person. Generally speaking, the most common symptom in about 80 to 90% of COVID cases is fever. The next most common symptom is a dry cough in about 60 to 70% of cases. After that, you're really looking at things like shortness of breath, and then in a small number of cases, sore throat, diarrhea. If you're unwell and you want to know whether or not you need to be assessed for COVID-19, the recommendation is to call 811. They are specifically set up. There's a COVID line that you can call, and they have tools that they can use to assess your risk and determine whether or not you need testing. And most people that get COVID-19 are going to recover at home, with only mild to moderate symptoms. And the most important thing for yourself is to rest, drink lots of fluids. For a mild infection, probably a couple of weeks, and then a bit longer for someone who maybe has a more severe presentation of the illness. So that's what we know so far. And if someone has been diagnosed with COVID, once their symptoms subside, they still have to remain under isolation until they have 2 negative tests 24 hours apart.
Together, we do amazing things every day.